Good afternoon, everyone. Thank you for joining us for the Innovative Community Responses presentation. In the interest of time, we're going to jump right into the presentation. And I am going to turn the floor over to Katie Burns, a Muskeg Health. She's with a Muskeg Health. She's the Adverse Childhood Experiences Response Team Supervisor under the New Hampshire Department of Justice. So I will turn it over to you, Katie. Thank you.
Thank you, Beth, and thank you everyone for having me today. So I am going to be going over in this presentation our program, which is the Adverse Childhood Experiences Response Team. We operate out of Manchester, New Hampshire, and I'll go over how we built the program, how it works, some of our successes over the years, as well as some of the tips and tricks that we have for building multidisciplinary collaborations to address childhood trauma in your community. So we can move on to the next slide. Great, thank you. So the Adverse Childhood Experiences Response Team, or better known as ACERT, is a referral network system that is generated based off of a first responder report. So that could be police department, which is typically what communities have as one of their core organizations, but it can also be emergency medical response or the fire department. And when we were looking at what we wanted to do in our community, we had a police intern go through police reports. For the entire year of 2014, they were looking at domestic violence reports, and they were specifically looking to see how many of those reports indicated that a child was involved in some shape or form. They were written in the narrative. Oftentimes, they weren't directly involved in the incident, but they were present in the home. And what that intern found was that there were over 400 children who were mentioned in those reports for that singular year. So it was really an indicator for our community that there were a significant number of children who were experiencing adverse childhood experiences, or ACEs. And I won't go too far in depth about what ACEs are, because I'm assuming that many of you are probably have some sort of basis information about ACEs, but ACEs are traumatic experiences that occur during childhood, ages 0 to 18, and they can have a negative effect on a child's brain development and can result in adverse experiences later on in life through different health difficulties. And as a child experiences more ACEs and their ACE score increases, the more likely they are to experience those adverse effects later on in life. And so we wanted to build a system where we could provide some advocacy for these children, because in those cases of domestic violence, we were providing advocacy for the adults through domestic violence supports, but there wasn't very much for the children who are experiencing what was going on in the home. And so the way that our response team works is anytime a report comes in from the police department that indicates a child is involved at all in that report, they will get, those reports will get funneled over to a family advocate who does case management for those families. And so our family advocate comes from an organization, Muskeg Health, which is where I work as well. And that's a community health provider. And that individual will then go through that report, kind of pick out the details of what's going on, and then make a decision on what types of supports and services in the community that could be helpful for that child, to provide mental health supports, but also providing any supports to the parents as well. And in addition to that Muskeg Health family advocate, we also have a YWCA crisis advocate. And the YWCA in our community is our domestic violence support service agency. And since domestic violence is our #1 call for service from the police department, we thought it was really important to have them looped in as one of our core organizations as well. So once our family advocate gets all of that information on a family, they start to attempt to make outreach to that family. And this isn't happening immediately after the police are going and responding to incidents. We want to make sure that families have some time to decompress and come down from that traumatic and crisis situation. So oftentimes our outreach is happening within a week of when that initial response occurred. And that team will be our Amoskeag Health Family Advocate, the YWCA Crisis Advocate, and a police detective who goes out in plain clothes. And that police detective is primarily there for the safety of the team, but also to be able to provide some information on the police's end and be able to be more of a community response individual, going to help the situation and work with families in less of a crisis and trauma situation. And so that team will go out in person, driving an unmarked car, and will visit with families, talk to them about adverse childhood experiences, talk to them about the different supports and services we have in our community, and offer up a release of information form that is a universal release, where if the family indicates they want to go to receive services at any of the organizations on that release, they can check that off, sign it, and then we have our family advocate send that information out to those organizations who will then contact the family for follow-up and intake. And the hope is that we're able to take that extra step off of families, not just giving them a brochure or a flyer where they would then have to make the call themselves, instead being able to provide that info to their desired organization to work with and put more of the work on their end as the organization end. And so we go out multiple times a week and are responding to families pretty often. We have a large number of cases that come in, as we are a city of Manchester, New Hampshire, with about a little over 100,000 people for population size. And that is in general how our workflows and our system operate. Once a referral partner receives all the intake information for an individual, they will then report back data to us as we are able to provide them with some of the initial funding that helps with providing intake and paying for those types of services. So we're getting some bi-directional communication from our partners as well. And we can move on to the next slide. And, when we're thinking about how we were able to develop the system and make it work pretty seamlessly, we think that the most important aspect was creating a concrete strategic vision and mission around the work that we were hoping to accomplish in Manchester with ACERT. And our vision as ACERT is to build a strong and coordinated community partnership made up of close-knit multidisciplinary agencies and organizations focused on the safety and healthy development of children and their families. And our mission is to respond to families and especially children in the wake of violence and connect them to appropriate trauma-informed supports and services in the community. And so in order for us to be able to have these conversations, these initial conversations with partners that we hope to get at the table, we had to have a good idea of what we were trying to accomplish with our program. And having that clear vision and mission was essential for us to be able to gain buy-in from these strategic partners and being able to share this higher level mission at every level within those organizations and gain that essential buy-in. And a part of that is important as well because when partners are able to see this overall concept, they're then able to determine where they fall within the work that we're trying to do. And they're able to have more of a commitment to that work. It's really important that I know all of the partners that I work with, if they're asked about their work with ACERT, that they're able to, in some way, shape, or form, regurgitate what the vision and the mission is behind the work, not word for word, but that they have a good conception of the work that we're doing and that everybody's on the same page with that work. And then we were also able to designate it out into specific deliverables as well, so that way partners could really understand the action items that we were hoping to do based off of this vision and mission. And so part of that was providing direct service to families who were experiencing adverse childhood experiences and provide referral services. So those are some of our direct deliverables. And that we also wanted to promote trauma-informed services training to first responders, as well as our other mental health supports agencies in the community. And that we wanted to be able to grow our community awareness of adverse childhood experiences and integrate our program into some of the larger initiatives that were going on in the local community. And we can move on to the next slide. And so we were able to gain the support from a whole host of organizations who were invested in being a part of this vision and mission. And that's the depiction that I have here on this slide is our system of all the different organizations that we're working with. And so we have the family at the center. That's the family that we're serving. They're the center of our focus. And then the inner circle is our core organizations. So like I mentioned before, Amoskeag Health, the YWCA, the police department, and the fire department, and emergency medical services. And these are the organizations that are making that initial direct contact with families. And once a family signs a release form, they are then referred out to that outer circle of organizations. And so we have anything from equestrian therapy, we have youth grief bereavement supports, we have athletic programs, we have the domestic violence services, we have the school district looped in, we have lots and lots of partners who are involved in taking these families' referrals and working with them afterwards. And so building these multidisciplinary collaborations, some of the tips and tricks that I've learned over the time that I've been working in this program is that it's really essential to be building interpersonal relationships with these partners. And I found that it's really helpful to do that before and after meetings. And I know that we're living in a very virtual time right now, but being able to do that in person for meetings can be really essential. So, you know, whether it's going to a meeting, specifically trying to show up to a meeting 10 or 15 minutes early because you know a couple other individuals at that meeting or that, you know, collaborative group is going to be there early as well. You can have some of these conversations about the exciting work that you are going to be doing and get them to be interested and really being able to boast about the work that you're doing in your community. But also, you know, building more of a personal relationship as well can be really important. I try to ask about how someone's weekend is, you know, how their family's doing, ask them about their leisure activities. It helps when I'm having those conversations with them later on to be able to bring up those, you know, minute details, because it shows that I'm more invested in them as well as an individual, and not just, you know, gaining their support for program purposes. It helps build those relationships and get people to buy into working with you long term. Another tip that I have is locating a champion within a potential partnership organization. And so a champion is an individual who has a level of authority within that organization to be able to, you know, vouch for the program and speak highly about it and work internally to gain more of that buy-in from higher level standpoints. So, for example, with our police department, we gained support through a champion who was a juvenile investigative unit and domestic sexual violence unit lieutenant. And so this individual was already working in this realm of work. And so it was very, very important to them. And being a part of this program was important. So they also, had this level of authority within the police department to then be able to have more conversations one-on-one with the police chief and be able to gain that buy-in at higher levels. Makes it a lot easier than having to have someone from a totally different organization try to do that work. Gaining that internal buy-in is really important. I also recommend hosting one-on-one meetings before doing those bigger, large group meetings. Before I have any of my partners convene as an entire group, I like to have one-on-one meetings with each of them to be able to figure out what's going on at their organization, figure out what's going on with them. A lot of times what I learn helps shape what I want to talk about during those larger group meetings. When you have a lot of people coming, especially on Zoom meetings, people can kind of clam up. So being able to have those one-on-one meetings is really essential to making sure everybody is participating in what you're doing as a collaborative. And what I've noticed too with starting like at the very baseline of building these collaborations is I was providing technical assistance to another community who was hoping to implement the ACERT model in their location. And they had me come on to one of their larger group meetings or stakeholder meetings. And at that meeting, the convener asked whether one of the organizations that was there was willing to be one of their core organizations. Who's interested in doing this extra work? And nobody really raised their hand. Nobody was offering up to help out with that. And it's not necessarily because none of them want to do that type of work. It's just difficult to be asking bigger questions like that in a larger group setting. Being able to, ask those questions and answer the questions of those individuals in one-on-one meetings can be really, really helpful. And so another tip that I have is the importance of leveraging existing partnerships in those recruitment efforts. It can be helpful for an organization who is new to the table to be able to hear from other organizations who have been well established with your program. Being able to hear and ask about the minute details, what's expected of them, how things look, what the commitment is like, and hearing it from another organization that's working at the same level that they would be working at can be really helpful for gaining that buy-in and getting their interest in being a part of your collaboration. And lastly, I have creating flexible and reasonable expectations for partners. Partners from all sorts of different organizations have a lot on their plate, especially now with the pandemic. Being able to meet them where they're at and creating, expectations that are not necessarily completely set in stone, have a little bit of flexibility, can be helpful for gaining people at the table in the beginning, and then being able to kind of add things on as that trust and as that support continues over time can be really helpful. And another aspect too, really driving home the importance of building interpersonal relationships before and after in-person meetings. For our program specifically, it was really, an idea conception that we had as a group of organizations, but we didn't have any funding right in the offset to be able to build it. And my supervisor, one of the original creators of this program, was at a coalition meeting and was speaking with an individual that she knew from a philanthropic organization, and was really excited about, ACERT, this is what we want to do, these are the people we have at the table, and just, talking about it within the, 15 minutes before the coalition meeting was going to start. And it got that woman to really be like, this is something that's really interesting. I'm going to bring this back to the people that I work with at my organization. And that's how we were able to gain that initial seed funding that we had, was really just from that initial conversation that happened before a totally unrelated meeting. So doing that it can be, the bridge that you may need to get things off the ground. We'll move on to the next slide. And so now I'll go a little bit more in specific about some of the different types of partnerships that we have, because different partners require different things for getting them at the table. And our first one is police and first responders. And for us, having the police department involved in our work was essential. That is where our referral mechanism is starting. So getting them invested was really important to our work. Some of the tactics that we utilized was one, speaking their language, understanding their perspective and how to utilize that understanding to gear conversations in a way that they're going to, it's going to resonate for them. And so police officers, they really understand generational justice system involvement. If a police officer has been involved with the service for, a certain amount of time, then oftentimes they will see entire families cycle through the justice system, because trauma is a generational thing oftentimes for families. When we were having those initial conversations with police officers, they would, speak anecdotally about how they would be responding to situations of domestic violence, and they would be working with the parents and the caregivers there, but they would notice that a kiddo would be on the couch, living in this environment, and they felt helpless, and understanding that they may see that child in 10 or 15 years in the exact same situation as their parents, and not really knowing what they could do to help out in that situation. So being able to frame our work as, this is a chance for police officers to provide that help and assistance was really appealing for the police department. And another aspect was framing this conversation in the idea that having police detectives going out in plain clothes and working with families on solutions for this trauma and crisis that's going on can be a way of reframing the community perspective on law enforcement. So a newer addition to our group is hopefully going to be a therapy dog who is accompanied by a police detective. And this is obviously if families agree to having a therapy dog come and visit, but creating that calm environment where adults and parents and kids can have police officers around and be able to talk about getting them connected to supports and services, and having that caring relationship can be really important to reframing the community perspective on how law enforcement interacts with the community members. And so that was of interest as well to the police department. It's also important to be looking at the numbers. So having that police intern go back and see that there were 400 children just exposed to domestic violence, that's not including, any of the other ACEs, the laundry list of ACEs, really was a good way for us to show that higher level of leadership in the police department, that this is something that would be really beneficial and is needed in our community. So being able to utilize that data and show that you need these supports in your community can help with gaining that buy-in as well. And then my last bit of advice is to utilize community events for in-person connection. Sometimes it can be really difficult to get police officers or first responders to the table at all. Sometimes you can't get them to answer your emails, you can't get them to answer your phone calls, or to get them to come to your meetings. But if you know that there is a event where the police officers are going to be there, so specifically I'm thinking of National Night Out, which is a big event for many police departments to go out into the community and table and provide this one-on-one time for you to be able to go and connect with them in person and talk about your work and talk about the importance of looping them into that can be a gateway as well to gaining their support. We'll move on to the next slide. And our other big partnership as well that a lot of other communities have a difficult time with gaining support is the school district. So to give a little bit of context about the school district in Manchester, the funding in New Hampshire for the schools is generated through property taxes. And thus Manchester School District has some limited funding, especially in certain district areas. At the local level, there is more of a conservative political leaning, which oftentimes is pushing against providing funding for social work and school systems. It's not necessarily something that that is seen as important and may sometimes be seen as fluff for the school systems, although we all know that that's not the case. The school district is in need of more social and emotional support services and social workers, and they know that, and they would like to be able to have these supports, but getting the funding for it can be difficult. And so when we had these initial partnership meetings, it was important for us to frame our conversations in a way that was going to be palatable for the individuals that we were talking to. And so part of that was framing it in a way that we were asking, what can we do for you? We understood that schools were in need of more social and emotional support services. So being able to have a conversation about how we can partner together to offer more opportunities for these services was something that was really desirable for the school district, as well as being able to offer opportunities for providing partnership in grant applications for different school project funding. As we were looking into grants to sustain our own program, we were able to figure out how to loop in the school district as well, which could provide them with funding if they were built into the budget of whatever grants that we were applying to. So, we were doing a lot of the grunt work of writing the grant, but they were able to provide us with the information of what they needed and have us work that in was really helpful for, getting them invested in coming to our meetings and being involved in the work that we're doing. And it was also important when you're having these conversations to, at the front, avoid some of the big operational asks. So not requiring these individuals to, have a huge plate of work that they needed to do. Everybody was already really strapped for time and resources. So starting off with pretty minimal asks was important. And as the partnership begins to grow and they begin to also, benefit from this collaboration, we're able to then ask for more asks and ask for them to come to more meetings and to put a little bit more investment in. And some of the lessons that we learned is that it can be really essential to actually network outside of your city and town and to attend more, statewide meetings and to leave that typical bubble that you may be working in within your own location. For us specifically, our champion with the Manchester School District was actually working in a totally different district before she ended up moving into her position with the Manchester School District. And so one of our founders was, having these conversations about the work that we were doing while she was in a totally different district, and really, setting that foundation with her about how exciting this work was and how we really wanted to get the school district more involved. And then once she ended up transitioning into a position with significant authority within our school district, all of that relationship building had already been done. And so it was pretty smooth being able to set things up at that point. And so it can be important to kind of figure out what's going on in other areas, because you never know when people are going to shift positions. And another lesson that we learned is that leadership turnover within the school district can actually be an opportunity for pushing action items. For us, it worked out really well that the superintendent was going to be transitioning out of their role. And so we were able to go to him and pitch all of the things that we wanted to do with this partnership. And since he was transitioning out, he's like, yep, sounds great. Let's do it. Why weren't we doing this before? It's low stakes for him because he's transitioning out. And we were able to make things happen pretty quickly. So realizing that there can be some opportunities like that can be really important. And we'll move on to the next slide. And now, I'm going to talk a little bit about sustaining and maintaining long-lasting partnerships. And in this picture is our AMR, the American Medical Response and Fire Departments, coming to some of our trainings that we host. Part of sustaining our relationships is gaining that understanding of the work that you're doing from every single level. And a big component of that can be offering these types of trainings and having all of the different individuals from every level of that organization being looped into trauma-informed care trainings and understanding the work that we're doing. So that's definitely an important aspect of sustaining our partnership. We also found it really important to utilize internal champions to maintain buy-in through leadership. So with the police department, we more recently have had a change in our police chief. And in some cases that can be really detrimental to a program if that new police chief isn't as invested in the work that you're doing. But it was really, it was great that we were able to have that lieutenant, that champion that I talked about earlier, be able to transition this new police chief into supporting our program through having those initial conversations as the police chief was coming into their new position, and being able to talk to them, police officer to police officer, and answer all of those important questions and provide that seamless transition. So it's important to utilize those internal champions to maintain that buy-in as you have people transitioning out of leadership roles. We also found it to be really important to have regular correspondence through things like newsletters, updates, and offering up resources to your partners. So being able to provide them with updates so that everybody stays on the same page is really important. We typically have meetings every other month, but I communicate with all of our partners through emails every single week. On Fridays, I send out updates to everyone, so everybody still feels pretty connected. And through our newsletters, I'm able to offer up things like trainings that they can provide for their staff, as well as updates to the different services that are being offered in the community. And that is something that all of our partners have found to be really helpful and have gotten them invested in reading my emails, because they know that they're going to get that newsletter that has a ton of really helpful information for their service providers. It's also important to give back to your partners in any way that you can. So whether that's through recognition or financial support, if that's a possibility, access to those resources like trainings that you're able to pay for them and their staff, or letters of support for different grants that they're applying to. If they're applying to grants, sometimes it can be really important to have that letter of support showing that they're involved with whatever program that you're working in. That can be something that you offer up to partners and have it be, a give and take between you and your partnerships. Also providing ongoing training opportunities. So that's kind of what I was talking about with the fire department as well as the police department. Most police officers know about ACERT, whether they work with it or not. They know about the program. They're excited about the program. All of the detectives that we have that go out on a rotating basis love the work that we're doing. And that's really important, because as we have individuals, again, shift in their positions, and move up on that totem pole within the police department, if they've already been involved with our program or have gone through trainings, then we're already priming them to be supportive of the program going forward. And the last one that I have is assessing the level of collaboration that you do have through surveys and determining gaps that can be addressed. So something we've done a little bit more recently is sending out surveys to all of the partners that we work with to determine what level of collaboration we have with them. And that's ranging anywhere from simple networking type relationship to an actual collaboration and collaborative work. And being able to determine where those weaknesses are between different partners can be important for targeting, the work that you're doing with building those relationships over time, because it's definitely something that you have to work with over, the long haul. It's not something that ever ends. And I think you can move me on to the next slide. And that is everything I have. And I guess I ended at pretty good timing to be able to take some of your questions and hopefully answer them. But thank you for having me. I have my contact information on here as well. ACERT is something that it's a model that can be, replicated. And if you're interested in technical assistance supports or, picking my brain of some of the things that I was talking about during this presentation, feel free to email me. Thank you.
Thank you, Katie. We do have several questions. The first is, are you using a specific curriculum when you train partners? If so, is it available?
Yes, so we actually contract out all of our trainings to a group called the Center for Trauma Responsive Practice Change. And they are based in New Hampshire. They are licensed clinical psychologists who have a background in training around trauma-informed care. So that curriculum is all about preventing re-traumatization when working with individuals, understanding how trauma impacts children and adults and their behavior. And they are really great because they are able to provide specifically geared trainings depending on who it is that is the audience. So they do police specific trainings, they do provider specific trainings, and can even get down to the type of service that those providers are offering. So that's typically what we do is we contract out that type of support.
Thank you. The next question is, given that law enforcement provides a notification to the advocate after responding to a call or having an interaction with a family prior to the team going out, were there any initial concerns on their part about confidentiality? If so, how did you alleviate those concerns?
Yeah, definitely. So that's a really great question. That was definitely something that was of concern and that we talked about during those initial meetings. What we were able to do was we were able to develop some confidentiality contracts where the individual who works with Amoskeag Health actually has a desk at the police department and will go through the police vetting procedures, background checks, to be able to have access to those reports and cases. And so the reports don't leave the police department, they stay housed there, and that advocate's able to sit at a desk there and be able to review them, collect the information that is needed. Any information that we are sending data-wise is all de-identified, so we don't have to worry about it on that front. But through the contracts that we're able to sign and through the process that the police department needed to go through for confidentiality, we were able to bypass any of those concerns and make it more seamless, our procedure.
Okay, great, thank you. Getting law enforcement and other first responders to attend trainings can be very difficult. How are you able to manage this?
Yes, so it can be very difficult. It can be very difficult, especially if it's virtual. Thankfully, when we were doing a lot of the trainings, it was before the pandemic, so we were able to do them in person. I think one of the benefits that we could offer for police officers is we were able to pay for those trainings and offer overtime hours to police officers who were attending those trainings. Also, being a part of our program, the detectives that are going out and going on those, deployments or those in-person visits with families are getting overtime hours as well and are able to be involved in that work and really care about the work. And so a majority of the people that were coming to those trainings were individuals who were interested in doing that extra work, being invested in that program, and would go through that initial training. And after that, those police officers really enjoyed the training. Those were the initial people who had the buy-in, and were able to then talk to other police detectives, talk to other police officers, and really hype up the training, talk about how much they loved being a part of the work and how relevant the training was and how it was really police geared and focused. Was essential to getting more police officers to come in on, the second and third rounds of trainings. So sometimes being able to tier your trainings up like that can be really important. But yeah, that's what we found to be as a successful mechanism for getting police officers to attend our trainings.
Thank you. What did the funding that you received cover? What kind of financial support is needed to manage the coalition?
Yes, so our initial funding covered the ability to hire a family advocate who would be able to dedicate a full-time position to working with the cases and doing that case management. The funding covered the overtime hours for police officers to go out and work with families. It covered a portion of the salary of the individual from the YWCA who would also go out, so it covered those hours. When we initially started, we were only going out twice a week. So that was, and each shift was 4 hours. So we were paying about 8 hours per week in overtime for police detectives, and then paying, 8 hours per week for the YWCA advocates as well. We also were providing funding for our trainings to be able to train all of the individuals who needed to go through that trauma training. We provided funding for some of the, higher level leadership who was, doing some of the higher level operational aspects. In total, we had about $50,000, which I believe funded us through the first year, and that was more than enough. We ended up having, some extra left over. So it's something that you can kind of work out based off of what the need is. And we found with other communities replicating our program that they were able to, delegate out the amount of hours that were dedicated to the program based off of how much funding that they were receiving. So it's definitely a flexible system.
Okay, great. We had one more comment about how adding the therapy dogs was a great addition to the program.
Thank you. I know that's something I'm very excited about. His name is Patch, and he's a little over a year old. He's a black lab. He is just the sweetest and so calming, and has just passed through that therapy dog training. So we're excited to be able to have him going out with us. I think it's going to help with developing more of a warm handoff for families and gaining that trust, and having more, candid conversations and getting people to open up a little bit more. So we're excited as well.
Okay, great. Thank you. I don't see any other questions in the queue. So thank you so much, Katie. Really appreciate your presentation.
Of course, thank you.
Thank you. And to close out the day, I'm honored to introduce Yvette Estrada. Yvette serves as a grant program specialist with the Office for Victims of Crime within the U.S. Department of Justice. Since joining OVC in 2012, Ms. Estrada oversees numerous grant programs focused on human trafficking and sexual assault. She coordinates the delivery of trainings at military installations throughout the United States in collaboration with the Department of Defense's Sexual Assault Prevention and Response Office to strengthen military civilian responses to sexual assault. Ms. Estrada has been instrumental in the development and execution of OVC's telehealth sexual assault forensic examination program focused on enhancing access to forensic care for victims of sexual assault. Prior to joining OVC, Ms. Estrada served as the program manager for sex offender management programs at the Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking Office in the Office of Justice Programs. So I'll go ahead and turn it over to Yvette.
Thank you, Beth, for that introduction. And thank you all for participating in day one of OVC's virtual grantee meeting. While we wish we could have met in person, we appreciated the opportunity to connect at least virtually. I have to say, today was definitely an amazing day. There was so much valuable information in only 4 to 5 hours. It was great to see such a huge turnout in multiple sessions. I think I saw at one point 100 plus attendees, which was fantastic to see. We learned so much today, not just for providing supportive services to children and families who've been impacted by substance use, but useful knowledge that we can use in our personal lives as well. I really appreciated hearing from our director, Chris Rose, on the importance of all the work you are doing and the impact it is having on youth and families. You are changing the path of the lives you touch, which in turn is transforming systems. From the science of hope, nurturing and building and sustaining relationships and partnerships to overcome barriers, creating trauma-informed school systems, whole family healing and treatment, you are all shifting the paradigm and stigma of substance use disorders. And for that, you should definitely be proud. I hope that you found today's meeting valuable and gained the knowledge in combination with your existing expertise to be able to better meet the needs of our youngest crime victims and their families. My wish is that your meeting experience will enable you to build on action plans that you may have already established to really bring about effective results in your communities. A big thank you to JBS International and their team, Dr. Chan Hellman, and all of the presenters today that shared their knowledge, expertise, and innovative practices. On behalf of OVC, thank you so much for the work that you do every day and for being here with us today. We hope you had a great day, and we will see you tomorrow for another spectacular day. Thank you.